Hi, I'm Cheryl Kagan, very proud to be the senator for Rockville and Gaithersburg. I apologize for my sore throat, but that's because I'm working too hard to represent the residents, the nonprofits, and the businesses in District 17. With me today as my special guest on this week's Kibbitzing with Kagan is the president and CEO of Westat, Scott Royal. Scott, thank you so much for being with me today.
Senator Kagan, I'm so pleased to be with you today. Thank you so much for having me.
Absolutely. So I have long been so proud to represent Westat, which is right near my neighborhood, near where I live, and is just not known by a lot of people, even though you've got over 1,700 employees and have been doing such important work. So why don't you give people a little bit of an idea of what Westat does?
Yeah, sometimes we're viewed as like this little secret gem over here, and we don't want to be so secret. So thanks for giving me the opportunity to tell you a little bit more. We are a large research firm. We are primarily, most of our projects are funded through the federal government, and we do some of the government's most important research projects in the area of health, education, and social policy. So, and that, to follow up with that, when I say health, we do health research in the area of like cancer research, public health research, infectious disease. We collect some of the government's most important data for data analysis around education performance. And we look at how well supportive employment policies are working, and we collect those data and analyze those data. So that's kind of a breadth of some of the work that we do.
And Westat has been around since 1963. I think that's—
Yes, we have been around almost 60 years. In fact, 59 years in January. So next year's our big 60th. So we'll have to do something to celebrate.
Absolutely. Well, I want to be at the birthday party.
Yes.
Now, you are also an employee-owned company. Why don't you talk about what that means to employees and why you think that's important?
Yeah, thank you. We believe that it fits our mission. Westats' mission is about improving lives. So the work that we do and the work that we take on is focused on improving lives. And so following up with that mission and our view of our employees, we believe that our employees are, that's the most important part of our work. What we do is our employees, they do the work. We don't make something and sell it. Our employees actually do the work. We sell our employees' time, right? And their work and their brain and their kind of efforts on behalf of Westat. So because of that, our employee owners are part of our culture. And so what that means really is that in the long run, Westat's entire value as a company is divided into shares. And we give those shares to people as part of their employment compensation. And over time, then that employee owns more and more of Westat, basically. And then they are allowed to that to grow, and then that becomes an important retirement type of benefit for people. So for people who've been here for a long time, it's an important part of their long-term compensation. And it allows them to be invested in Westat, not just passionate about the work they do, which of course, but also passionate about our success as a company, because it ultimately pays them back as well. Yes. So it's a great model for supporting employees.
Yes. So when I came to visit you a couple months ago, who knows timestamp anymore, 3 years ago,
Right.
2 minutes ago, whenever that was, there were a lot of folks that were working remotely. It was a pretty quiet building, and normally it's so engaged and dynamic. Tell me how you've addressed the challenges of keeping people connected during COVID.
That's been very hard for us, but we've, I think, met the challenge pretty well. When COVID hit, like a lot of other employers, we weren't prepared for all of a sudden within 3 weeks time. It went from be careful, maybe don't come into the office, shut down. So it very quickly. And quite frankly, it coincided with me moving from the president role to the president and CEO role right at that time. So it was my first crisis, and what a crisis to be dealt.
No kidding.
But I will say I'm so proud of our Westat employees, because everybody took on the challenge with a positive attitude, So our IT group, made sure everybody had the right tools. We all tested our internet connectivity. We all made sure that we were able to have, Zoom and or Teams and whatever in place. We all switched all our meetings. We made sure our client, our government client relationships could be maintained. We had a bunch of meetings scheduled that had, hundreds of people attending, that we were the host, and we made sure that we had the stability in our infrastructure to do all that. And all of that happened with virtually no blips. So, in that initial time, almost 2 years ago, I think we made a great transition. I think the hard thing for us has been, as you point out, we've continued to be in this in-between place. Just when we get to a point, we worked over the summer talking to staff about how they wanted to come back and what kind of cadence they wanted to come back. And then all of a sudden, we had a resurgence with the Delta variant and then the Omicron variant. And so, I think if we didn't have a whole group of people who work on public health and epidemiology, we'd have a lot of people who'd be going, what the heck's going on? But we have a lot of staff who actually work front lines on COVID, and they're like, we understand. So we've remained flexible. I look forward to the day where we have more people coming into the office. I like to be here in the office when I can, but we have to, focus on our staff safety first thing.
Yes. So one of the modest but significant silver linings in the challenges with COVID and the remote working is that you've been able to hire and engage with experts who live anywhere. They don't have to live in or near Rockville or Gaithersburg. Why don't you talk about how that has changed and whether you anticipate that that would continue in a post-COVID world, whenever that is?
Yeah, that's a good point. We really have seen that. As I mentioned, just a second ago, that we've increased the amount of work that we're doing in infectious disease research as part of this COVID crisis. And because of that, we've had to increase our ranks of epidemiologists and biostatisticians and other specialized capabilities relevant to that kind of work. And this is one example of a capability that we've been building. But that example is important because, those people with that kind of training don't grow on trees. It's hard to find the best people to do that work. And if we said, hey, you have to come to Rockville every day, we might find somebody whether locally, let's say who lives in DC or Northern Virginia or Frederick, Maryland, or, wherever. And we might lose that. We've had some people in Columbia, Maryland, people who say, hey, I don't know that I want to commute. So this has helped us attract people, and even people, as you point out, we have an office in Atlanta, but we have a lot of people in the Atlanta area, North Carolina area, Texas, other places where we've been able to hire people and been able to bring the best people in, regardless of where they are. So I think it's taught us, kind of trial by fire, so to speak.
Yes.
But it's taught us that we can actually find the best talent and engage them with these current tools. Yeah. And I think we've learned a lot from that.
So we've talked about public health. Is there a way can you explain Westat's role in helping move us forward towards a day when COVID is behind us? You've worked with CDC and so many other agencies. Can you talk about what role you all feel like you've played and how you've made a difference?
Well, I like to say that our most important role as we support those important clients with their very difficult positions and decisions that they have to make. So when you think about CDC and the hard job that they've had, over the last, 2 years, but I am so proud of what we've been doing for CDC. For example, over the weekend, in the New York Times, you may have caught an article that was talking about how we had data now to demonstrate that in the US, to demonstrate that the third dose, the booster, actually does significantly prevent in large populations of people serious illness, hospitalization, and death, right? And so those data were published by CDC in their weekly Morbidity and Mortality Weekly, MMWR, and our Westat staff were co-authored on that paper because we collected those data for CDC and help CDC analyze those data and present and publish those data. So we feel like, how are we moving things forward? We're moving things forward by providing high quality data to our clients like CDC, like NIH, like other important federal clients, and helping them make these difficult decisions or get out this important information.
Yes. So one of the other amazing things about Westat is the way that there's a corporate encouragement in volunteerism and giving back. And as the senator who fancies herself as the senator for the nonprofit sector and is so focused on more businesses doing that, I'm just so proud of your ethos in that. Can you talk a little bit about that?
Absolutely, and I'm happy to. We believe that the work that we do, that we actually get paid to do, should align in some ways with how we contribute to the community. And important ways where we do that, we, for example, run the Cancer Trial Support Unit contract, where we support operationally a great number of the National Cancer Institute's clinical trials. And you, I know, are familiar with the Children's Inn. And the Children's Inn, it provides housing, education, social support to children and families whose children are participating in clinical trials at NIH from all over the country. And so we are a corporate sponsor of Children's Inn, and I actually was recently asked to join, and I did join the board of directors for Children's Inn because I believe so much in their mission. We can all get behind providing the housing and believe in providing housing and social support to these families who are helping us with this important research. But it's this also, without the Children's Inn, we couldn't do this research.
Right.
We couldn't enroll enough children in these studies. We couldn't move ahead clinical research as boldly as we do with our great gift of NIH if we weren't providing this kind of support to children and their families. And so by providing this, we're actually not only providing this direct support, but we're also supporting clinical research more broadly. So we're very proud of that. We also provide, we also do a lot of support for, we are sponsor the Presidential Scholarship, recently established Presidential Scholarship at Montgomery College. And we have also been a supporter of the ACES program at Montgomery College, both of which are supporting students. We're a huge believer in supporting Montgomery College and the students there because that helps build our pipeline. It helps us, by providing such great education to a breadth of diverse students that are from our area. Mm-hmm. And we as Westat can inspire them to go into some of the careers that are helpful to us, like some of the research careers. And so we are huge supporters of Montgomery College in that way as well. So those are just two examples of where we try to give back to the community.
So you've opened up another rabbit hole because I was going to go in another, but let's continue here with Montgomery College. And then I'm also a big fan of universities at Shady Grove, USG. Yes. And in terms of a pipeline, I wonder if someone watching this might be interested in learning more about Westat, but more importantly about applying to work here. What do you look for in a prospective employee in terms of educational and other experiences?
Well, I think I tried to say, we do a breadth of research and we make research fun. It's a fun place to work. It sounds like people are all holed off in their office, but we're very collaborative in what we do, and it requires a team. So we hire people with a breadth of, capabilities and talents. So people that are interested in, does education make a difference? is there a way to measure whether education is making a difference or leading to good outcomes? I mentioned some of the COVID research we do. We support clinical trial research. We do, as I mentioned earlier, we look at whether supportive employment programs help people who otherwise would be on disability. But if they could get supportive employment, can they stay in the workforce and actually continue to contribute? So those are the kinds of things. But so that requires people that have degrees, advanced degrees often, in epidemiology, biostatistics, sociology, education, research, public policy, a lot of masters in public policy. So people who have these breadth of capabilities. But it's not just those, we also have almost every single one of our business units require a lot of strong IT infrastructure. And I don't mean just turning on the computers like we have today for our podcast, but I mean actually the data structures, like how did the data fit? How do we make sure that we make it easy for people that are participating in the research to enter those data? And how do we make sure they're secure? So every single group has assigned IT infrastructure staff. So we hire a lot of people with IT capability as well, and those capabilities. And sometimes we hire people right out of college who are not sure what they want to do, but we sound really interesting to them, and they have an interest in research, and they've demonstrated that in their undergraduate. And they come here and work for a few years, and they get inspired by a biostatistician, and they say, that's what I'm going to go do next. So they leave us with our blessing and go back to school, and hopefully we bring them in. Or we have tuition support. So we're saying, if you want to stay here and you want to go to school part-time, then you can do that. And you can stay here and do that in one of our local options. So those are the kinds of skills and capabilities we require, and hopefully we help people achieve them.
Fantastic. I'm looking at my questions and figuring out where I want to go next. NIST, the National Institutes of Standards and Technology, which is also in my district, and one of the coolest federal agencies that no one's ever heard of. Do Westat and NIST work together? Because it seems like that would be synergy there sometimes.
I'm not aware right off the top of my head of our doing work for NIST, but we work for a lot of different agencies, but it may not be one of our larger projects.
Got it. So let me go back to your volunteerism. You are on the board of Metro Teen AIDS, and I wonder how you selected them. And why don't you do a quick public service announcement for the important work that they do?
Well, that was you're so good at research that you're finding my former volunteer jobs. So that's okay. I was on their board for a number of years. They actually merged in with Whitman Walker Clinic a number of years back. So but the mission of that organization was to provide HIV prevention services to young folks in DC. And so I did that for a number of years. And then after that, I served on the board of Capital Caring, which Capital Caring is the one of the area hospice organizations. And I served on that for a number of years, which is a great organization, still serving our area well. I've also been on the board of BB Hospital Medical Foundation, which is BB Hospital in Delaware, because we have a place in Rehoboth Beach, and trying to support the development of that important healthcare, a really thriving community hospital and healthcare organization, and supporting that. And then now have just recently joined Children's Inn Board. So being a part of like your commitment, Senator Kagan, to nonprofits in our area, I have a strong belief in nonprofits and the value that they provide to our communities, and have made that an important part of my personal life. So
fantastic. So speaking of your personal life, you live in Gaithersburg and you work in Rockville. So you are just all about District 17 here. Why do you choose? You could live anywhere. You could also probably work anywhere. Tell me, what about mid-Montgomery feels like the right quality of life for you and the place that you want to call home and work?
Well, I love Montgomery County. I think Montgomery County is a wonderful place. I think that our Westat chooses to be here because it's such a great place to work. It's so supportive of our businesses in the right way. And the community at large has just created such a vibrant community for both living and working. So I think but not only the local government and the Montgomery County Council is so supportive and supportive of us, the state government, your commitment to knowing all of your constituents has just, it feels like a small town in a big place. And I think that that's the environment that we hope that Westat also contributes to that environment as well.
Small town in a big place. I kind of love that, actually. That's great.
You can borrow it.
I am just writing it down and putting it in quotes. I totally share credit, though, give credit. So before we go to the Fast Five, you have a magic wand. Give me your glimpse into the future. What would Westat look at like 5 years, 10 years down the road?
My hope for Westat 5 or 10 years down the road is that we continue to be known for our strong data collection competencies. We do in-person data collection across the country, but that we continue to grow in areas of like education policy, health policy, public health, infectious disease kind of research, so that we continue to be an even larger partner for our federal clients and even into some of our state clients that we have as well. So I don't want to say more of the same, but I want us to diversify a bit our research so that we continue to attract people who have stronger capabilities that are very future oriented, but still in the research realm. We do a lot of work in the public health using data science capabilities. So my expectation is that we will grow that capability because it will become more and more important, data science and data analytics for the future. So I want us to continue along the same line, but do it bigger and better.
That's great. Love that. So is there anything we haven't talked about that you want to brag about that Westat is either doing now or working on?
Well, I think that I have bragged a little. I've bragged some about our COVID work. Yes. We are getting ready to go into what we call the field with our National Assessment for Educational Progress study, which is one of our largest contracts. During the winter, when we go into about 20,000 schools in 6 weeks across the country, and it's a representative sample of school districts and in schools within the school districts and students within the schools. So it's called the Nation's Report Card. So we're getting ready to start doing our report card collection, and it's quite an undertaking this year, given some of the challenges that COVID has posed. So
I have to tell you that today, Maryland's new state superintendent of our Maryland State Department of Education, our whole state's public school system, just today was talking about the NAEP findings and ratings and how Maryland compares with other states and all that. So I will be eager to hear about the 2022 findings when they are ready.
That's great. Yeah. I look forward to sharing them with you, or having our Westat leaders share them with you. Yes, that's perfect. So Scott Royal, President and CEO of Westat, based in Rockville, Maryland, the Fast Five. 5 quick questions to let folks get to know a little bit more about you. So question 1. If you could travel anywhere in the world and neither COVID nor time nor money were an object, where would you go? Italy. I've never been to Italy and I really would like to go. And so it's one of my first trips post-COVID we want to plan. Perfect. And where? The whole country or any particular part? Well, I would love to do the whole country, but I've been warned that, you have to spread it. So Florence is my first city that I'm just dying to see. Yes. Probably would fly into Rome, and I really want to go to the Amalfi Coast. So that might be enough in the first trip. Florence is beautiful. You will love it. You will love it. Question 2, do you have a favorite podcast that you would recommend that others would enjoy? I don't, and I don't listen to a lot of podcasts, and I feel bad about that. So maybe you could tell me what do you think would be a good one to get me hooked?
So I will pivot the question because it's about you. Is there a show that you have binged recently that you have loved that you want to share?
Yes, the Queen's Gambit. I binged recently, and that was like fabulous. And it's a perfect binge because it's not that many episodes. And I was like, I really got into it. I loved it.
So I'm a nationally ranked Scrabble player, as you may or may not know, and the Scrabble community just loved it because there are a lot of similarities between the chess community and the Scrabble community. We're nerds, and the competitions and tournaments and stuff are really similar, actually.
I love it.
Yeah, loved that. Love that. Question 3: when you were a kid, what did you think you wanted to be when you grew up?
When I was a kid, I thought that I wanted to be a musician. So I played piano and I thought that's what I wanted to do. So
nice.
But I don't think there's a lot of it takes a similar mind, I think, for music and for research. So
yes.
I think there's a lot of similarities there.
They say that music and science, and that it really enhances young people. Do you still play piano at all?
I do occasionally still play. So you lose it if you don't use it, type of thing. So I need to stay. I don't practice as much as I used to. So
yeah. Question 4: if you could switch jobs with anyone in the world for a day, what would you want to check out?
For a day, I'd like to switch jobs with the owner of a wine shop.
Nice.
I think that would be kind of a really cool job. I'd love to talk to all the people and hear about the dinner party they're planning and try to make a recommendation and that kind of thing. I think that would be a really fun job.
Nice. Are you an enophile? That's the right word, right? A lover of wines?
Yes, I am. So
Great. And the last question, Scott Royal, the question that I ask everyone: what is your hidden secret superpower? What is a skill or talent, something you're really good at that most folks can't do?
I think probably it is. I have a lot of patience. And I think that I am good at, and that works well in being a diplomat. And I'm in a lot of situations that require me to think before I talk, process what I'm feeling, and realize that there's that long-term goals are perhaps more important than short-term kinds of moments. So I think that's one of my gifts, and I think it's something that I've been able to use well.
So Scott, you need to teach me that someday.
Oh yeah, I would just spend some time with you on that one.
Totally not one of my superpowers, actually. It has been such a treat to kibitz with you today. Thank you so much for taking time out of your busy schedule to chat.
Thank you so much for giving me some time, Senator Kagan, and thank you so much for your service. You make a huge difference here in Maryland.
I'm grateful. Thank you. I look forward to seeing you in person again before too long.
All right. Thank you.
Stay safe. Take care.
All right. Bye-bye.